All right. Good morning. Good afternoon. I am Carrie Scott. I work at Spruce Health. We have Gabrielle Juliano-Villani with us today, and we're just watching these numbers climb, but they are climbing steadily. And because we have so much great content to cover today, I think we should just get started. Let's do this
Yes,
thing.
I'm excited.
I
Let's
am
go.
you. Hey, all right. So we're here today to talk about the ins and outs of Medicare in mental health. And that is important because it's now open to LPCs and marriage and family therapists, which presents a number of exciting opportunities. And Gabrielle is going to dig into all of those today. To just quickly cover off on our agenda, I'm going to intro Gabrielle and let her say a few words about herself. For those of you new to Spruce, I'll give you the very quick nutshell of what Spruce is, and then we're going to get right into the meat of it. What is the Mental Health Access Improvement Act, why it's important to you, why it's important to your clients, how you can sign up, how it can actually provide you with a consistent stream of clients, how to check for rates and fee schedules, eligibility, and more. With respect to questions, Gabrielle is totally open to answering questions as we go if they're relevant to the material that we're covering at the time. If not, I will just save them and we will get to them at the end. So be sure to use that Q&A down at the bottom of your screen. We disable chat because it can get a little bit nutty, but the Q&A is 100% for those questions. And please feel free to drop them in there as you think of them. And if we can get to them in the moment, we will. And if not, there will be time at the end to get those answered. So don't worry. I also want to mention to you that this is being recorded. So if you have to drop off early, if you're interrupted, if something happens, I will be sending out the link to the recording later today. So you can revisit this and you'll have access to it to get back in there and listen in on anything you may have missed or want to learn more about. So on to the next slide. Again, today we are here to talk about the Mental Health Access Improvement Act. We are going to get to listen in on Gabrielle telling us how she impressively scaled her group practice to 7 figures before selling it, all while being a Medicare provider. So beyond the other benefits that we'll talk about, there's certainly the monetization, which is pretty exciting. And with that, let's meet Gabrielle and dig in. I'm going to let her intro herself because we all know more about ourselves than other people. So please, over to you.
Thank you so much, Carrie. I'm really excited to be here with all of you today. And if you don't know me, I'm Gabrielle. I am an LCSW. I live in Sarasota, Florida now, but I used to have a thriving group practice in Denver, Colorado, which was specifically focused on Medicare clients. And I did scale that practice and I sold it in 2021. So now I do lots of consulting and training on Medicare and documentation on how to pass audits. And I also do lots of consulting and training and coaching on how to scale your practice, how to add other income streams, how to sell your business, and also on burnout prevention using nervous system regulation techniques and polyvagal theory. So I do a lot of different things, but it all ties together. And I'm really excited to share it all with you today.
I love that. Thank you. I know we opened the call with me saying to Gabrielle, she is a Renaissance woman. She does it all. Incredible. Real quick blurb on what is Spruce for those of you who may be new to us. So Spruce is a healthcare communication platform. And what I mean by that is it's a lot of folks refer to it as their office in their pocket. So whether you're using your phone, a tablet, computer, what have you, it's a communication that's designed for anyone working in the medical space. HIPAA compliance is easy to adhere to, et cetera, and it consolidates all of your communication channels. So business phone, fax, text, telemedicine, it's all in one unified cloud-based solution. And what we hear is that it absolutely makes day-to-day so much easier. So if any of you want to learn more about it, or you're not on Spruce and you want to give it a shot, jump on our website and try it out for a couple of weeks for free, and shoot me any questions you may have. But that is it in a very quick nutshell. And now we're going to get to the heart of it. And I'm just going to sit back and let Gabrielle take over, but I'll be watching your questions as they come in and I'll be following them to Gabrielle as we go. So with that, off to you.
Thank you so much, Carrie. And again, thanks everybody for being here and for participating. I am very excited to share all of this with you as someone who has been billing and credentialing Medicare for a very long time. I started my private practice as a sole Medicare provider. That was the only insurance I took for the first couple of years in practice, and I can talk more about marketing at the end if you folks want to. And then as I scaled into a group, there was 15 of us, and I did all of the billing. So I was billing hundreds of Medicare sessions every single week. And I know now that we are excited to welcome LPCs and LMFTs and LMHCs. There's a lot of questions. I've also been hearing a lot of fear and a lot of misinformation. So I am here to help you with all of that. I want you all to take a nice deep breath. It's not as scary as it seems. I've been doing this for a very long time, and that's why I'm going to share all of this stuff with you. So hopefully we can work through some of that fear, and I can really show you that Medicare is not as scary as it seems. So like I said previously, only social workers and psychologists were able to bill Medicare for mental health services. And so this has been such a long time coming. I am very happy that this has finally happened, as it should have happened a long time ago, but here we are. 2024, you're able to bill Medicare now. So you are now eligible to be a Medicare provider if you are a counselor, a marriage and family therapist, or a mental health counselor. So this expands counselors' ability to provide services. And also there is a huge shortage of providers. And I think there will continue to be, even though we are finally expanding this, but that's really why I was able to build my practice so quickly, is because there was a shortage of providers. And when people in my community found out that we accepted Medicare, that's all we needed. I didn't even have a website until I had already hired 4 people. So if that tells you anything about the need for services with Medicare. So it's going to improve that access to care. And that means that more Medicare clients hopefully can get more services, especially through telehealth. So under this new legislation, we are increasing access to mental health by expanding the availability of telehealth services. Now, like I said, LPCs, MFTs will be able to see Medicare clients. And that's also helpful because, especially in those kind of underserved or more rural areas, at least they have a little bit more access now than they did before. So that's going to help with the shortage, as well as just having more providers in the Medicare network. Okay, so how to get started. This is what I always say when we're getting started with this. Take a deep breath. It's really about mindset, a lot of this. Remember that we're working with the government here. It is a little bit of, learning some new things, learning some new language, understanding the ins and outs and some nuances, which I'm going to talk a ton about today. But if you go in with it thinking about it like that, it's going to really help you a lot. Because what I see a lot is that people get super frustrated, then they're angry, they're upset, and it just keeps spiraling and spiraling. And then you have all this stress that when we're thinking about burnout, you don't need to carry that. So deep breaths, mindset, think about it in a different way. So you'll have lots of information today to help you get started. And I also have more resources to help you as well. But we'll be talking about the documentation, credentialing, billing, all of that stuff as we get going here. And I will also say, if you don't know me, I run Medicare Consulting for Therapists.com, and I have a blog on there. I have tons of resources on there, and I also run a Facebook group with the same name, Medicare Consulting for Therapists. Tons and tons of resources in there. You can sign up for my email list if you want. I send Medicare stuff just about every week, but the Facebook group and my website are really great places to go for additional information if you need it. So first of all, you need to figure out your eligibility. So you're all eligible and you need to get an NPI if you don't already have one. And then when we're thinking about NPI, I'm going to talk about this later as well. If you have an LLC, even if it's just you need an NPI too. And so that is very important because if you take other insurance, you may not have it structured that way. But it doesn't matter if it's just you and it's always just going to be you. Medicare wants you to have an organizational NPI too if you have an LLC. So I want to make that very, very clear because I've seen this a lot in the Facebook group is that people are applying with their NPI 1, but they have an LLC, it's getting rejected, they're getting frustrated. So that is the answer. You do need one for that. And I usually recommend that anyway with other insurance because a lot of commercial payers are moving towards that anyway. And then the application is on this system called, in Colorado, we would say Pecos. I don't know if it's Pecos or Pecos, but I call it Pecos. So everything is online here and we have it linked and I actually know what it is. I think it's pecos.cms.hhs.gov. And that is where everybody goes, no matter where you are, to apply for Medicare. You can also do a paper application, which some people have found that easier. The only issue with a paper application is that, when you send it in, if there's a problem, it's going to take longer for you to know about that problem and to fix it, and you can't really check your status or anything. So that's just some information to know. The application, again, it's the government, so it does look like it hasn't been updated since 1980. It probably hasn't. I find the application to be the hardest part for people. So what I usually recommend is set aside some time, gather all your documents if you're going to apply and, just do it all in one chunk. Or if it's easier for you, you can break it up. It'll save your space and you will go back. The Pecos application pulls your information from a system called Identity and Access Management, and that is actually the same place where you go to get your NPI. So it already pulls from that system. So you want to make sure everything is correct. Your address is correct, your phone number is correct, and that you are set up already in that identity and access system correctly because the Pecos application or Pecos, whatever, is going to pull all the information from there. And it used to be if you were a group, you had to do a group application and an individual application. They just changed that and now it's a combined application. So you do one for the group and you check, there's a box that says you are the owner of the LLC, and that does the individual application and ties it all together. So even though Medicare is a big national thing, it is split up into different regions, and those are called MACs. That's the Medicare Administrative Contractor, and that's who manages Medicare in your region. So that's who you go to for claims issues. That's who you go to check eligibility. Basically, anything past the initial application, your MAC manages that. That's also who sets the rates because the rates do change from different states.
Oh, Gabrielle,
Yep.
I have a couple of questions that came in. I also wanted to let everyone know that I will be sharing the slides and any links that Gabrielle is mentioning. Don't worry if you missed it. I will make sure that I include that in the follow-up email that comes in later. So just a couple of questions if you are okay with that.
Yeah.
Can LSWs submit claims to Medicare if they are under supervision?
The only way they can do that is under a psychologist. That's called incident to billing, and it's only allowed if there is a psychologist who is employed at the organization and you can bill under them, but you can't bill under an LCSW.
Okay, great. Do therapists have to opt out of Medicare now, or if not, be unable to opt out later?
I'm going to talk about opt out in a couple of slides, and I will get to that.
Okay, perfect. Then we will just hold on that. Boop, boop, boop. Can one practice have a therapist who is credentialed with Medicare and another therapist who opts out of Medicare?
Yes, and I'm going to talk about that also,
Okay.
because yeah, we'll talk about it.
Okay, perfect, perfect. You had mentioned telehealth in one of the early slides, and maybe we'll capture this later. But this question from Margaret, do they pay the same for telehealth as in person?
Yeah, let's hold on that one too, because I'm going to talk about billing.
Okay, great. And then so you're going to talk about insurances. Maybe we hold on that.
Mm-hmm. Yeah.
How about, do you want to answer this one? What's the difference between an NPI 1 and 2?
Yes, great question. And NPI 1 is tied to you as an individual, and NPI 2 is tied to the organization. So if your practice is Gab's Counseling Practice LLC, that is who the NPI 2 would be tied to. But then me as an individual, I would have my own NPI 1.
Got it. So even sole proprietors with an NPI, they also need an NPI 2?
If you have an LLC, you can be a sole proprietor, but if you have an LLC, that is the issue here. So I think where it gets confusing is because the way CMS is talking about this, and also other commercial payers, and the way the IRS identifies these things are different. So if you, even if it's just you, if you have an LLC, then yes, you need an MPI too.
Okay. All right. Perfect. Patrice was asking for that website again for PICOS or PECOS, but I'll just include that later in the follow-up emails. So don't worry about any URLs that Gabrielle mentions. Boop, boop, boop. Okay, you're going to get to billing. So I'm going to hold on some of those. Okay, I'll hold on these others and let you keep going. Thank you for
Okay.
that.
Yeah, you're welcome. I think we'll probably answer a lot of them in like the next couple of slides.
Perfect.
Okay, so there it is. I have it right there for you. Oops, pecos.cms.hhs.gov. That's where everybody goes to apply for Medicare, everyone. So again, I talked about identity and access management. You want to make sure everything is correct in there, and you will know because you'll be able to see it, and Medicare is going to ask you. Again, like I said, if you have an LLC, you need an MPI too. So when you are applying, I would gather all of this stuff so that you have it. I always kept it in like a Google Doc for myself. And then for my team, I also had all of their stuff together as well. And that just makes it easier in general because you never know when you're going to need these things. And you're going to need your MPI information, your practice location information. So you do need to have some sort of a physical location. Some people use their home. I sublet from somebody for $100 a month and I used their location. You need something. So if you put a virtual mailbox, it's going to get denied. And a lot of commercial insurance is moving the same way with this as well. So a way to get around that is what I did. I sublet from somebody for $100 a month, and they also let me put a sign up on their door that said the name of my previous counseling practice, because Medicare can do a site visit. It doesn't mean they will, but they can. And the reason why is because there is so much fraud with Medicare, like tons and tons, billions and billions of dollars in fraud. So that has made it a little bit more difficult for us. But again, it's very easy to get around this. I find that people get really upset and freaked out about this little piece of information, but it is very easy to get around it. And also on the application, you can check if you are a telehealth only provider. But if you do put a virtual mailbox or like a PO box, it will get denied. So you can avoid that very easily by either putting your home or using somebody else's address if you're only telehealth. And that's what I did. I just used somebody else's. You'll need your malpractice insurance. They also oftentimes ask for your diploma, so you might want to have that around too. You will need your bank account information. And again, I just want to stress this a lot because this is an issue that I see a lot, is that people's information isn't matching. And so this can be not only a problem for Medicare, but it can be a problem with other payers. It can be a problem when you go to file your taxes. Your business name should be the same everywhere. So it needs to be the same on your bank account, on your malpractice insurance, with your NPI. Like, it needs to be the same everywhere. That's really important because, again, I don't just see that as a problem with Medicare. I've seen it with other issues with other payers too. And that's really a huge pain to go back and correct. So make sure everything matches. The other thing I don't have on here that you will also need is the letter that you got from the IRS when you got your EIN, if you have a tax ID. So that's another thing that people get frustrated about. And I will just tell you, not even from a Medicare standpoint, but just from running a business, any of that kind of stuff you get, you should save. Try not to say shoulds, but you should save it. You never know when you're going to need it. So, like when I sold my business, I needed that. And I also needed it for a couple of other things. So make sure you save all those types of things that you get when you start up your business, because it's just best practice for you to have all of that information. So that's where you apply. This is a map of the max, and I know it says December 2020, but it hasn't changed. So I also, on my website, medicareconsultingfortherapists.com, under resources, I have this map here, and I have each MAC linked. So if, when I was in Colorado, we were with Novitas. So Novitas is the one who manages all of these states. They manage Medicare there. So that means that's who I went to. If I had a question, if I had a claim issue, if I needed to check eligibility, this is where I went, and they managed it for us. So those are your people. That's also where you check rates, which I'm going to talk about as well. So now you know who to go to if you have specific Medicare questions in your state and who manages it. And so I have all those linked. So talking about rates, this is another thing that comes up a lot, and they do vary state by state. So yes, some states, they're not great. And some states, they're actually really good. I just had 2 consulting clients. One was in Washington State and one was in New York. And they said that the rates were way higher than they thought, and almost to like one of them was their highest payer. So I encourage you to check, because it does vary in different regions and different states. And on my website, I have a whole blog on how to do this. But basically what you do is, you want to figure out, who your MAC is. So if you don't know, we're going to go back. So that's what website you need to go to. So if you're in Florida, it's First Coast Services. So it's FCSO. If you're in Texas, it's Novitas. If you are in Georgia, it's Palmetto. So you want to go there. After you go there, it's actually usually pretty easy. So you can go to the links on my website. You can also just Google MAC for whatever, or Novitas Part B provider schedule. So those are a couple ways to find it also, but you will look for the fee schedule once you get on that website. We are Part B providers. That's another thing that we need to know. Medicare has different parts. Part A is for hospitalization and inpatient. Part B is anything outpatient. So that's doctors, specialists, that's us. So that's what you want to be looking at. Some of them have like an Excel spreadsheet that you download, but most of them just have a place where you'll see fee schedule, and you'll look for like Medicare physician fee schedule, and you can just type in 90837, or you can, Control F if it's an Excel spreadsheet and type it in. And then this is the other thing that trips people up, because there's a lot of stuff and you're like, what does this all mean? You're going to look at PAR, because that means participating, right? And if you're going to accept Medicare, you would be participating. And non-facility, because we're not in a facility. That means being in a facility would be like if you worked for a nursing home, or if you were billing in a hospital or something like that. So if you are in private practice, outpatient, just you, or you have a group practice, we're looking at participating non-facility. And this is the other information that is really important. Master's level therapists get 75% of that posted rate. Hopefully, this will change. The NASW has been advocating for it for a long time, and now that we have more associations on board, hopefully that helps us too, as we have more advocacy power. So we get 75% of the posted rate. So when you look at this participating non-facility, whatever that is, let's make it easy because I can't do math. If it's $100, that means if you're an LPC, an LMFT, an LCSW, you get 75 bucks. The other really important thing to know is that Medicare pays 80%. So 80% of the 75% comes from Medicare. So what happens with the other 20%? That's the coinsurance. That means that the client has to pay it if they don't have supplemental coverage, or Medicaid may or may not pick it up. It depends on your state and what the rates are. If the Medicare allowable amount, so that 80%, if it's more than what Medicaid would pay you, then you wouldn't get paid from Medicaid. So that's important to know too. That's why a lot of people don't like to take Medicare, Medicaid clients. In Colorado, it did pay because the allowable amount was more. So we were able to bill for that 20%. This goes much deeper. We don't have time to get like too in depth with that today. I just wanted to give you all enough to understand where to go and how to do it. I also have a blog on how to do it. I have a video of how I do it, and I show you and I walk you through it. So if you go to my blog, I think it's called something about your guide to Medicare rates. That's what it's called. And I have a video there and I walk you through it. So I would recommend looking at that. And then I go much deeper into supplements, if the client pays it, and Medicaid in some of my Medicare courses as well. But this is enough for you to understand, to get started, to understand if taking Medicare makes sense for you. So it's not for everybody, right? And that's fine. But I think you should check before you make that decision, because I have talked to a lot of people the past couple of weeks who said, oh, I read this blog somewhere and it said that the rates suck, and so I'm not taking Medicare. And then we go in and we actually look in their region and they're like, actually, that pays well. So I am going to take Medicare. So just do your own research. This can be one revenue source. It doesn't have to be your entire practice. It can be a great way to get clients. For example, another coaching client of mine, she's in Florida, in Miami, and she said, I checked the rates and they're not the best, but they're also not the worst. And I'm having a really hard time getting two of my clinicians filled up right now. And we get a ton of calls for Medicare clients. So she's taking that because it's going to fill up her two clinicians who otherwise would just be sitting empty with no income coming in. So those are business decisions that, you can evaluate for yourself or with me if you need more help. So talking about billing now, yeah, okay. I knew I was talking about opt-out in here somewhere. But first, let's talk about billing. You can bill through your EHR. I think that's the easiest way to do it. It's the most streamlined and just makes things a lot easier. But you can also bill through Office Ally, which I believe that there is a fee for that. I'm not super familiar with Office Ally, but I know people who do bill Medicare through there. And then also each MAC has its own portal. And after you get approved as a provider for Medicare, you want to sign up to get access to your MAC's portal. And you would just go to their website and you'll see it says something about like registering. And you want to make sure that you do that because that's also where you check eligibility and all of those things. And you can bill through there. I believe that they also have just changed to a different software if you're going to bill through the portal. And I will be honest, that's something that I don't know a ton about. I'm extremely familiar with billing through an EHR and how to bill and what needs to be on there, but this software I'm not super familiar with. And again, I just recommend, doing everything through an EHR if you can, even as a single provider, because it just does make things way more streamlined and easier, and you have everything HIPAA compliant in one place. So when you are billing Medicare and when you're billing any insurance, you always want to bill your full rate and they will pay you the contracted rate. So make sure that you're doing that and you bill Medicare Part B of your state. So in simple practice, in all the EHRs, you search Medicare Part B of Colorado, Medicare Part B of Michigan. Remember, that's who you bill because we are Part B providers. And in most cases, Medicare will automatically forward to the supplemental plan to cover that 20% coinsurance. In most cases, there are some weird little one-offs that I'm not going to get into. I talk about those more in my courses, but 95% of the time, it forwards it to the supplemental plan, and you don't need to be in network with those supplements. If they are a true supplement, they're also called a Medigap plan. You do not have to be in network with them because there's a lot of really weird ones. Like we used to have one that was National Elevator Life, and I was definitely not in network with them. And so that's really nice is that you get paid from Medicare, Medicare sends it to the supplement, and then in a couple weeks you get that 20% co-insurance paid back for you. And you'll be able to see also on the remittance advice, it'll say forwarded to United Healthcare AARP or whatever it is. Yeah, there's again some nuances. I cover those more in my billing course, but generally it's very easy billing wise. And we were talking about telehealth. So telehealth is covered, and so is audio. So that's good because you might do a lot of phone sessions with Medicare clients. We did a lot. And so this is a topic that's coming up in my group right now because all of the information I had from CMS said that telehealth was going to pay the same as in person. And then they advised us to bill place of service 10 if the client is at home. So, but a couple people have said claims are coming back and the allowable amount is less. So I'm holding off, I guess, on that right now. I think what probably happened is they had the rates loaded wrong or something. I'm assuming it's a mistake because all the information that came from Medicare last year said that telehealth was going to be covered at the same rate as in person to help with accessibility. So get on my email list or join the Facebook groups because I'll have more information as that comes out. Claims take 2 weeks to be processed, so we're basically right at 2 weeks considering the first was a holiday. So we will see, but Medicare said that they would pay them at the same rate, so I hope that they do. But yes, telehealth is covered, audio is covered. You would use, most of us are using place of service 10 for regular Medicare. 02 is if it's taking place in a facility. And so I think people get really tripped up on this as well because there are some, I guess, again, nuances to say that word for the millionth time already. But place of service 2 is if it was happening in a facility versus 10, which is if the client is at home. And the question that we get a lot is, what if the client is at work or they're in their car or they're at their friend's house? And I would still use 10 and just document that. The difference here is that Medicare is trying to delineate or differentiate from people being in a facility and people not being in a facility. And so they're not going to have every single place of service that, therapy could potentially occur. I think it was just easier for them to make it 02 or 10. And so previously, before the pandemic, Medicare only covered telehealth at originating sites. That meant that these sites, so facilities like a doctor's office or a hospital, had to have special credentialing basically to do telehealth. And the client had to travel there and do telehealth there, which defeats the purpose of telehealth, but that's how it was previously. And that was paid at a lower rate because it was in a facility. So now that life has changed quite a bit over the past couple of years, they added place of service 10 because most of us are not in a facility. And if you go to my Facebook group, we have a ton of information in that on the featured or the pinned post. Everything is at the top. So you can read about that there also. And I know that we get a lot of questions about opting in versus opt out. So I want to spend a little bit of time here. Opting out is a formal process, and it's not the same as commercial insurance where a client can just say, I don't want to use my benefits. This is totally different. This is a formal process through Medicare. I don't know why it is this way because I don't know, it was written into the Social Security Act many years ago, and that's just the way that they did it. So if you want to accept money from a Medicare client, you need to opt out, or you can refer them out. That's the other option. When you formally opt out, this is done through your MAC. So remember that map that I showed you earlier. They all have a form that you fill out there. It's like one page and it's very easy. And the one thing to know though is that your opt out is tied to your NPI 1. So if you are a group practice and you have 30 therapists who work for you, all of them have to submit a form to opt out with their NPI 1. So it's tied to that. And you also want to make sure, that those people who are opting out aren't working in a hospital somewhere else, because that can screw all of that up. So it is tied to the NPI 1. When you opt out of Medicare, that means that you are also opting out of Medicare Advantage plans, and it means that nobody is submitting for reimbursement. It means that the client and you are going to have a private contract. The client is going to pay you. They cannot submit a super bill. So that's really important to know also. That means that nobody is getting reimbursed from any other payers. They're paying you and that's it. There's no super bill being submitted. It also lasts for 2 years. However, the first time you opt out, you have 60 days to change your mind. And you just contact them. I think they have it on the bottom of the form on how to do it when you get back, but you can enroll. So we just had somebody in my group today who she opted out and then she changed her mind. So you can change your mind the first time, but if you do decide to opt out, it is for 2 years. And again, it means that nobody is submitting for reimbursement. No super bills are being submitted at all. The client is paying you and that is the end of it. There's also a lot of fear and confusion about opting out. There are social workers that I know who never took Medicare and who never opted out. And they said, in all my time of 20 years of having a practice, I've had one Medicare client and I just referred them out. So you can also do that as well. So if you're not sure yet, you can just refer the client out. And so I would just be really clear, if you are a private pay practice, having clients, asking them, do you have Medicare? Do you have a Medicare plan? Or, they could sign something saying they're attesting that they don't have Medicare if you are worried about it. Because what can end up happening is, somebody is paying you, you didn't know they had Medicare, you didn't opt out, the client goes and submits a super bill, and Medicare can come back and ask for that money to be returned, and you can also get penalties. So it can be serious, but I really think that people are getting way more stressed about this than they need to. You can choose whether or not you want to accept Medicare. If you're opting in, you're not automatically opted in either. You do have to go through the Medicare credentialing process. But if you're opting out, then this is the process that you do. And I have a blog on how to do that. And then it lasts for 2 years. Or you can do nothing and you can just check every time a client calls you. And you can say, I don't accept Medicare clients, and you can refer them out because it is such a specific process. So yeah, those are just things to think about. And so, like, I've had a couple of people talk to me about, I have a private pay practice, but I don't really work with the Medicare population. I work with kids and I'm full and I have a wait list. And it's like, you probably don't need to bother to do this. You can, just to cover yourself, just in case there's a caregiver issue, right? And you're working with the caregiver. But you can just take those extra steps and refer those clients out if you want as well. So it is tied to your NPI 1. So when you are filling that out, you put your NPI 1 on there, and then you will get something in the mail from Medicare saying that they received it. You do have to mail it in or fax it in. So some people usually send that certified mail. And also just remember, we just had the floodgates open of people who could become Medicare providers. So if things are taking a little bit longer, that's why, because there's just a ton of paperwork being submitted right now. And whatever effective date that you sign on that form, that's what they'll put as your opt out as well. Carrie, did we have any questions about opting out?
Oh, Gabrielle, we have so many questions.
I figured.
I have to be honest, I didn't want to interrupt your incredible flow, but I don't think I've seen this many questions in a webinar ever. My gosh. Yeah, there are so many. Boop, 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 boop. Right now we're at 62 open questions. Let me just look really quick if any of these are about opt out. Okay, here's one from Margaret. I tried to opt out to take a self-pay Medicare client, and my max said I couldn't opt out because I was never part of the network. Oh, it's simply a comment that it was very confusing. I imagine there's probably going to be these instances where that happens. Yeah.
Yeah, I mean, the rules just changed, and yeah, that's always
Yeah.
happens, right? When things change,
Yeah.
that there's a little bit of a transition period. And if you submitted it before January 1st, that can also be an issue. So I didn't talk about that because it's after January 1st now, but if you did submit it before January 1st, a lot of those came back because you weren't eligible.
Okay, interesting. I have a follow-up question to that. Does that mean that then that person can go back in and resubmit, or because it happened in 2023, it's not eligible?
Resubmit it, send it back in, and just put January 1st, 2024 is what I would do.
Perfect. Okay, here's one from Jody. Does opting out also require GFE?
Yes. So if you're opting out, then that person is going to privately pay you.
Okay.
So
Okay.
you do have to do that because you're entering into a private contract where somebody's going to pay you out of pocket.
Okay, perfect. Can you opt out per client, or do you have to opt out across the board?
No, it's across the board. You can't pick and choose. So either you are opting out, you're not taking any Medicare clients at all, or you could do nothing and still not take Medicare clients, or you're opting in and you're billing Medicare.
Okay. All right. Here's one I'm not entirely certain I'm reading accurately. From Regina, are Medicare clients not allowed to choose not to use their benefits then if you're not opted out?
So that is a good question. I think that's a really slippery slope. If it's a covered service, which therapy is, then you should be, if you're a Medicare provider, you should be billing for it, unless they don't meet criteria maybe for a diagnosis, which doesn't happen very often. Just thinking about the common issues that we see with people. So if somebody comes to you, they have Medicare, you're a Medicare provider, they want therapy, I would try to bill for it because I think that trying to, I don't know, I could just see a lot of issues with that. So I would probably not do that. There is something called an advanced beneficiary notice that people can sign that says this might not be covered. So you could do that. I would probably do that, actually have them sign that and then bill with a code that's not covered, like a Z code. And then you can show like it's not covered. So they're going to pay out of pocket and they could pay out of pocket that way. But I would just really cover your bases with that one.
Okay, perfect. Here's a question that says, I heard that an opt out lasts 2 years before you have the option to opt back in. Is that true?
That's correct. Except for the first time you opt out, you do have a 60-day window to change your mind.
Okay. All right, very good. Let's see if there's any more specific to opt out. I'm going up, up, up. Oh my, there are so many questions here. I bet.
I knew there would be.
You know, right? Okay, here's one from Janice. Do you have to sign up with Medicare to then opt out?
No, all you have to do is fill out the opt-out form and send it in.
Okay. All right, good. Okay. That may be most of them, but I'll let you
Okay.
keep going and then we can get back into questions again before we wrap.
Okay.
Okay.
Perfect. Okay. Yeah, let me see what time it is. Okay. Oh, it's already 2:45. Okay. So, audits. I know it's a scary word. Let me tell you something. I have a training also on documentation. I have passed Medicaid audits. I have passed Medicare audits. I know that it seems very scary and that there is all this like information out there that Medicare audits a lot. I know people who have been providers for 30 years and never been audited. So it really just depends. That is just the risk that you take. They could audit you, they could not audit you. I don't think that it's any more than commercial insurance. And so again, that's the risk you take when you are a provider, is that you could get audited. So less about that, more about prevention, which is making sure that your documentation is really good. And again, this is not just for Medicare, this is for anything, any insurance that you take, and even just generally, right? Because there are other reasons why people might need to look at your progress notes or your records. If a client files a grievance, God forbid, hopefully that doesn't happen, or there's a claim, whatever, you have to go to court. So just generally, make sure that your documentation is on point, and it's not as hard as it seems. I think this is another thing that people get really scared and overwhelmed with. And I mean, again, they do audit, but I don't think it's any more than commercial insurance. I think they probably audit more in places where there's more fraud, like Florida. So we have a lot of retirees down here on Medicare. And so you just want to make sure that your documentation is good. They most often do something called TPE audits. I also have a blog about that on my website. Those are targeted probe and educate is what that stands for. Those happen most often if you are billing unusually. So if you are billing like interactive complexity, or if you're seeing a client multiple times a week for a long time, that might be a reason. Let me also tell you, as somebody who has been through audits, that they don't just come in and say, we're taking all of your money. What they actually do is they say, this is what we want to see from this client or this client, and they'll look at it. And if it meets criteria, you're good. If it doesn't meet criteria, they're going to give you some education on what they're looking for, what you missed. And they're going to say, we're going to come back in 45 days and we're going to relook at it again. So you do get some support there. But I have a training that's also linked on my website on how I passed an audit, what you need to know. I have a note template on my Etsy that helped me pass Medicaid audits. And also somebody just messaged me and said she passed her Medicare audit with 0% errors, and she used my template. So that was really awesome. So some of the things just to think about: medical necessity. My note template has that on there. It's mostly check boxes. You do still need a good narrative, but you need start and end times, the duration, all of that needs to match the CPT code. That is the most common recoupment issue, is that, and not necessarily with therapists, just in general. People are billing 90837, but the note says they only saw them for 40 minutes. So make sure all of that matches. Treatment plans should have SMART goals, again, not just for Medicare, but also for commercial insurance. You also need a HIPAA compliant training on file, so you can, do that. There's a lot of free ones out there, but you should have that on file also for commercial insurance. Another thing that comes up a lot is that people didn't know that clients needed to consent to telehealth. Again, this is not just a Medicare thing. This is compliance with telehealth. You need to have that in your note. I have it just as a checkbox in my note template. So I want to just touch on that briefly. But if you need more help with that, I would recommend heading to my website. You can read the blog, you can buy the training, or you can buy my note template. I want to get through this because we have like 10 minutes left, and I know that we have a lot of questions too. So just briefly, again, I had a group practice that started just solely as Medicare. I only took Medicare for the first couple of years, and I had more clients than I knew what to do with. So this can be, again, a really great revenue stream for your practice if the rates work for you and this is a population that you want to work with. They are very rewarding clients. They can be seen during the day, which is also really nice. But I was able to build a practice on Medicare. I did scale it to seven figures and I sold it in 2021. And actually, the buyer was attracted to purchase my practice because we worked with Medicare. So it can be a really good thing. And again, you just need to think about what works for you. But I want to always share that because, again, I think that there is a lot of like this fear and information out there that Medicare is difficult. And it wasn't. It was not for me at all. And that's why I'm here sharing all of this with you and why I have all of the resources for you so that you can make a good decision about whether you want to take Medicare or not. And how I did that was mostly networking. If I actually networked with one social worker and one doctor's office who accepted Medicare, and she built my practice at the very beginning. So once people find out that you accept Medicare, it can be a really great way to get clients. And just like with any other client that you work with whatever niche, you want to identify where they go and how to reach them. And Medicare clients usually go to the doctor a lot. So that's a great way to just do direct outreach and build up those relationships. And so I won't talk too much more about that. We can talk about that at a different time if we want. But yeah, I want to make sure that we have time for questions. We talked about all these things here. If you head to my website, you can join the Facebook group. You can see my courses, which literally walk you through credentialing and billing step by step. And also my webinar that I did on how to pass an audit. I talk about what needs to be in your notes and everything there. And then I'll just leave this up. If you want to connect with me, you can scan that QR code, follow me on Instagram, on TikTok, on LinkedIn, and then I have all the links for the Medicare stuff I was talking about, and then my other website, which is more focused on business coaching and consulting and retreats. I'm going to Belize next week to lead the first one, and there's a second one coming up with June. So if you feel stressed about Medicare and you need to relax with some sound healing, come to the June one and I'll be able to help you out.
I love it. This is incredible, Gabrielle. Honestly, you've covered so much terrific content. I'm going to jump right in and we're going to just see how quickly we can get through some of these questions. They may have to be real brief on your side too. Okay, here we go. If you take Medicare, do you also have to accept other insurances? We are out of network providers, but are interested in accepting Medicare.
Nope, you don't need to. I only took Medicare for the first couple of years, so you can make that choice.
Can you apply multi-state?
You can, but you will need some sort of address in those other states.
Okay. That actually reminds me, that address that you provide, is that going to be made public? If somebody uses their home address, is that going to be public information?
It could be. And
Okay.
so think about that too, not just with Medicare, but your business and your MPI. So a lot of people put their home address for like their licensure and their MPI, and people can see that too. So make sure that it's covered everywhere if you don't want it out there.
Okay. All right. Perfect. Do I have to have an independent license to bill?
Yes.
Okay, great. This one I think you already answered. Can you bill under an LPC or LMFT supervisor? And I believe you said yes.
You cannot.
Oh,
So
you can.
anybody who anybody who has a provisional license, the only way that you can bill for them is under a psychologist.
Okay. All right, perfect. Jody's asking, why would I want to opt in or out? How to make that decision? That sounds like a big one. Should she just head over to your site?
Yes.
Okay, perfect. That's a big one. Can you apply for Medicare if you haven't applied for Medicaid yet?
Yes. So Medicare and Medicaid are two totally separate things. Medicare is federally run and Medicaid is state run. So even though a lot of people have both and they do kind of go together sometimes, they're totally separate. And they are separate credentialing processes. So any Medicaid questions, you'll want to find somebody in your state because I'm only familiar with Medicaid in Colorado.
Okay, perfect. Incident to billing is only for psychologists, not LPCs.
Right. So you can only bill incident to a psychologist. So anybody who has a provisional license, they need to bill under a psychologist. If you have a full independent license, you need to make the decision really to either opt out or to opt in or to do neither and not see Medicare clients at all.
Okay, perfect. Here are two questions, both same. If you're a sole proprietor and don't have an LLC, do you need an MPI too?
You do not, only if you have an LLC.
Okay, yeah. And then actually the second question was, I have an LLC, but it's only me. So should I get an MPI 1 and 2?
Yes.
Okay. Wow, this is confusing.
I
Okay.
know.
Oh my Lord. Okay. Do you need 2 years post license to apply for Medicare?
Nope, you just need a license.
Okay, great. Okay. If I'm already in the identity and access management system as an individual, can I add my NPI 2 to that profile or do I need a brand new one?
Yes, that's actually a really good question because that system is also extremely confusing. And I think I said this in the beginning. I can't remember now, but the application is the hardest part. And if you can get through that, it'll be much smoother sailing afterwards. So you can only have like one login for identity and access management. So you will have you in there and you'll have your business in there as well. And you need to be an authorized official for your business.
Okay. Wow. S corps weren't mentioned. Do S corps need an NPI 2 as well?
Yes, I would assume so because you're probably some sort of bigger entity. So, yes.
Okay. Can master's level psychologists submit claims to Medicare directly without being supervised by a PhD psychologist supervisor?
Well, if they have a license, so it doesn't really matter if they're masters or not, but they need to have a clinical license.
Okay. All right, perfect. Is there a checklist to prepare for a site visit? Yes, right? I think you said you had that.
Yes, and really what you need is just your business needs to be on the door and your hours of operation. And I know a lot of people in my group just have by appointment only, and that seems to be fine.
Okay. All right, perfect. Sending that. Okay. I'm gonna skip some of these that are somewhat similar. Oh my goodness, there are so many.
I know.
Yeah.
And I will also tell you that that's why we did a lot today, but if you want more and you want more help and information, go to my website, go to the group. Those are good places to start. And then the courses are amazing. I put everything you need in there and you get as many replays as you want and lifetime access.
Okay, that's incredible. Here's one from Chris. Do PSYCD and PhD get paid 100% versus 75 for master's level?
Yes. So clinical psychologists do get the full 100% of the
Okay.
rate.
Okay. Let's see here. No, there are some unlicensed, I believe both are covered. Okay, if you're licensed in 2 states and both are covered by Noridian, do you need 2 opt-out forms?
I don't think so. I
Mhm.
think you should be fine if both are covered by Noridian and you send in one. I think you're okay.
Okay, all right. Um, it says, okay, do you need special training to do Medicare?
No,
Not
I
really.
mean, you should generally, from a clinical perspective, you're going to be working with a lot of older adults, but people who have end-stage renal disease and people who are on disability can also be on Medicare. So my youngest Medicare client was 18. My oldest was 101. So there's a big span in there. And so that's important to know too. If you enjoy working with grief and loss or chronic illness or chronic health conditions, you can accept Medicare and you would still see some of those younger people in those populations. So you don't need special training, but you'll be seeing a lot of older adults, a lot of people with chronic health issues, um, grief and loss, life transitions, caregiver burnout, those types of things.
Okay. Honestly, we have 61 open questions, which we can't possibly get through. But what this shows me is that this is a very fascinating topic to a ton of people. Gabrielle, you have been incredible. And I would just say, what should folks just reach out to you if they want to learn more and pick your brain and get in touch with some of your really cool courses and curriculum?
Yeah, so reach out to me. You can join the Facebook group. You can head over to my website and join my email list. And I send lots of information there every single week, usually. And in our Facebook group, if you're on Facebook, I have at the top of the group, it says featured, and there's just tons of Q&As that I've done, lots of videos, and then the courses are linked on my website. My Etsy is linked on the website as well. And yeah, I can stay for like another 1 to 2 minutes if there's any other questions, Carrie, that you want me to get through really quickly.
Oh my gosh, girl, I gotta say, there's just so many. Beep, 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 beep. I wouldn't even know where to begin if I'm honest
Okay,
with you.
that's okay, because I know there's a lot, but I think the best way really is to go to my website, get on my email list, read the blogs, and then think about buying my courses because it's going to answer most of these questions.
Yeah, this has been incredible. I would even be tempted to do another one of these with you because I can see that there is just so much interest and passion around this topic. So a huge thank you to you for joining us today and for having so much incredible insights into this very new topic. Like you are a gem here, and I think everybody was excited to get to listen in. I, again, will send a follow-up email to all of you. I will give you access to the recording, to the slides, to the links that Gabrielle mentioned. You will all be prepared to venture into this new world if you are ready. And it sounds like you should give it a go. It's not that scary.
It's not that scary. It is a great way to grow your practice. There are 11,000 people turning 65 every single day. The world is not getting any better. There's going to be a continued need for services. So yeah, it's been great. I loved being a Medicare provider, and obviously I love talking about it, and I'm happy to help any way I can.
Love it. You are terrific. Thank you to you, Gabrielle. Thank you to everyone who joined us today, and stay tuned for our webinar next month. We'd love to see you again.
Thanks, Carrie.
Thank you. Bye, guys.
Bye.